How many people on a daily, a weekly, a monthly basis die on the street?
We're averaging in Sacramento 1 to 3. It depends on the season.
1 to 3 a week?
1 to 3 people a week who die on the street.
On the street.
Now, not all of those are due to terminal illness, obviously. There are injuries, there's homicide, suicide, overdoses. But the number of people dying with terminal illness is increasing, the percentage, because when you're homeless and living on the street, unsheltered, you're going to age faster. You're also not going to get the preventative care and the screening and the primary care to keep you healthy that you get if you're sheltered generally. So when they do have developed cancer, for example, it's usually not diagnosed until it's a late stage cancer. And then just living on the street, it's very difficult to keep medications. They either get lost or stolen.
Or stolen, yeah.
If they need to be refrigerated, they can't be refrigerated. It's hard to get to clinics. With the Affordable Health Care Act, many of the homeless were able to finally have insurance. But they were assigned to clinics, wonderful community health clinics that serve that population. But the problem would be that they're living on the street in downtown Sacramento, for example, and their clinic could be in Elk Grove or somewhere at a distance.
So transportation is an issue.
They have no transportation. Yeah. So what they do is when they have a health issue, they call an ambulance who takes them to the local ER, which is a tremendous cost for the city and for the hospitals. So, and as you progress through a terminal illness, you're going to need to be seen much more frequently. So they're making frequent trips to the ER to get some sort of treatment, whether that's pain medication or chemotherapy or whatever treatment they're receiving.
So it's costing these hospitals and other medical facilities, it's costing them money.
A lot of money. I'd like to just also add that, in the public's mind, I think a lot of people think that homelessness is a result of some really bad choices. They're drug addicted, they have mental illnesses. There's an element of it couldn't happen to me. And I think one of the things I've learned is that they're there generally because of circumstances out of their control. In fact, we have a very dear friend now who just suffered a stroke earlier in the year, whose husband had a major medical issue, and they are about, because of the mounting medical bills, they are about to lose their home, lose everything they have, and could become homeless. Wow. And these are people who've worked hard all their lives, done so much for the community, and now they're facing that possibility.
Right, and it was not through their own choosing.
That's right.
Yeah. And that's not to say, you're not suggesting that there aren't some homeless people that have made some choices that put them in that kind of situation.
Absolutely.
Yeah. But there are also many others that have not.
That's
Something
right.
beyond their control got them to that point
That's
where they're
right.
now homeless. Okay.
And then some of those folks who got there through no fault of their own, really, turn to drugs or alcohol to kind of deal with the fact they're homeless. So it can be a kind of two-edged sword.